So back to the serious question. Toughest moves, maxillary laterals, extruding canines is a very tough move. Mandibular incisors for me is my nemesis. Tooth number 25 is my least favorite tooth to rotate in the whole mouth usually. Crowding or spacing cases greater than 6 millimeters. Rotations greater than 40 degrees often give GPs difficulties. And those famous blue and black movements. So how do we capture? What do we do for these tough tooth movements? What's the equalizer? Right there. That's your answer. So when you're into that second and third and fourth, and God knows, I don't want to go beyond that, additional set of aligners, you have to use the equalizer. I'm not going to lie to you. There are cases that I have not started with a VPro or with Propel, but if I'm getting to the second set of aligners, I will hand it to the patient and I will say, I'm going to do this for you. No, there's no additional charge for it because they know if they're not compliant, there's additional charges. But if it's an issue of tracking and I don't feel it's a major compliance issue, I will often just hand them a VPro and say, you have to promise to use this, and there will be no additional charge for you. So if you have these available in your office, then you can use them. The mistake I made early in my VPro career, I didn't have them available. I was waiting to order them. I'd wait till I say, oh, I have a patient that I need to do Propel on. Let me go order a couple devices and I'll have 2 or 3 in the office. I have a stock of these in my office now. And when you have a stock of them in your office, that's when you use them, because you will look at these cases and go, well, I have a lot of blue movements in this case, or I have that black movement, that rotation of that lower premolar. I've never seen one go, and this is a, a patient, 64-year-old patient. I don't want to offend any 64-year-olds on here tonight, but a 64-year-old patient where, the bone isn't as soft and as compliant as it is on a 16-year-old patient. And I want to make that predictable. You know what? If you have a box of VPros in your office, this is where you charge it up, you hand it to the patient, and you say, you need to use this 5 minutes a day. And that's how you successfully implement these devices into your office, is to have them there. If you don't have them there, you will never use them. You will never use this technology. And if you don't have them, the next time you do refinement, remember that you should have had them there, because you could have avoided the refinement or reduced the amount of aligners in the refinement. You may not have 26 aligners in your refinement. Maybe you'd only have 8 aligners in your refinement. So these pay for themselves. I love devices that pay for themselves over and over and over. These devices pay for themselves. That's what people don't understand. These devices, though, actually save you money or make you money. It's just like having a scanner in your office. If you have a scanner in your office, you're not going to take impressions anymore. If you don't take impressions anymore, you're going to save on impression material. That saves you money. If you don't have retakes, if your crowns fit better, that's going to save you money. That's what these devices do. They save you money over and over and over, and they let you do more difficult cases predictably.